Hello, I'm Matthew Semler. I'm a pulmonary and critical care physician here in Nashville. I wanted to take a minute and tell you about what I'm experiencing as a part of the current phase of the coronavirus pandemic here in Middle Tennessee. I'm working in the intensive care unit right now, and over the last 4 or 5 months, I've cared for many patients with coronavirus who are critically ill and dying who are from the Middle Tennessee area, and I want to share with you a little bit about their experiences. I've cared for patients who were as young as 19 years old and as old as almost 100, all critically ill from this new virus and in need of help. And my experience, I think, seeing those patients and seeing how seriously ill they become, and in some cases seeing those patients that die, has brought home to me how important it is for us to all be contributing to this effort to help prevent people in Nashville and our community and in the state of Tennessee from experiencing this in the future. I'll tell you that one of the most painful experiences for me taking care of these patients was a young man who was from Nashville, who was a little bit younger than I am. He was in his early 30s and had been a football player in high school and was healthy, didn't have a lot of health problems, and had been trying to stay home and take care of himself, and unfortunately was exposed to coronavirus despite those efforts. Came into the hospital and was, we got to know him, was a very funny, kind person, and unfortunately, despite all of our best efforts, this 30-year-old with no health problems died from coronavirus through no fault of his own. And that coronavirus he got from someone else in our community, and the reason he got it, one of the most likely reasons he got it, was that that person wasn't wearing a mask. Our state of Tennessee has not mandated masks, and had we, I think deaths like that would be potentially avoidable. If Governor Lee does not require a mask mandate immediately, our state, which is currently spiraling out of control, has increasing number of cases and increasing number of deaths, is likely to spiral further out of control to the point that our only options left are shutting the state down in a complete lockdown, or accepting that thousands of other patients like that healthy 30-year-old football player will die. The stay-at-home order earlier this year worked in the sense that it was effective in slowing the spread of coronavirus, and it bought Tennessee valuable time that we needed to address this public health crisis. But instead of using that time to gather ourselves to address this public health crisis like many other states did, Tennessee reopened in a rushed way without the necessary cautions like mandating masks in public. And now things, because of those actions, are even worse than they ever have been. Health experts, public health experts, doctors know that masks are one of only a few interventions that actually slow the spread of coronavirus and save lives. The World Health Organization, Centers for Disease Control, our federal government recommends that anyone over 2 years of age should be wearing a mask and staying apart from each other, and that's to protect children, families, and other people. I think that's an important part of this to understand. When masks are mandated, it's not necessarily to protect the person who's wearing them, right? It's to protect the people around them in their community. When people refuse to wear masks, it endangers the liberty and the safety of those around them. It's comparable to when people ignore speed limits when driving, drive recklessly. They're fined for that not because they're endangering their own health, but they are, but they're also endangering those around them. And that's why it's such an important public health approach and why it needs leadership from our state. In this health crisis, not wearing a mask and not staying apart endangers the lives of countless others and prolongs the health crisis for all of us. This is not an issue of individual liberty, it's an issue of leadership. The real issue here is that Governor Lee has refused to be the leader that we elected him to be. He's rejected calls from health experts since March to take responsibility for leading in this crisis and providing Tennessee with a comprehensive statewide plan that we can all count on to get COVID under control. His rush to reopen the state without the necessary precautions, its refusal to mandate masks, a simple intervention that we know protects all of us, passes the buck to local school boards, mayors to figure out how to deal with this pandemic all on their own, and it's made things worse. Tennessee this week had the worst week we've yet had in the pandemic. This isn't a surprise anymore. It's not February and March and we don't understand how to control the spread of the virus. There's no excuse at this point for us not having the simple measures that can prevent Tennesseans from getting sick and dying. Tennessee has gotten to such a point that the White House Coronavirus Task Force itself has assigned a red alert to the state of Tennessee, suggesting that we need a mask order and other simple provisions like that to keep us safe. If Governor Lee doesn't require a mandate for masks immediately, I worry our state will spiral further out of control so that our only option is going back to completely shutting down again or simply accepting the fact that thousands of Tennesseans, through no fault of their own, will be exposed to coronavirus by those not wearing masks, will get sick, and some of them will die. Governor Lee, by failing to make wearing masks in public required, you're failing the state, you're failing the citizens and the patients that I'm caring for today and every day. So I urge you, please, to mandate masks in public as a simple, effective, cheap intervention that can save patients and spare hospital systems and end this pandemic and get us back to work and back to school soon safely.